My name is Dr. Abigail Amankwabwatin. I'm a pediatric student and a public health professional. My daily work is to attend to children who are not well, and sickle cell disease is one of the commonest conditions I usually come across. So I'm excited to be here to have this discussion. Also, a health speaker, and I educate communities, families, because I believe that an informed person or an informed community can make an informed decision. So it's something I'm also very passionate about. Thank you.
Thank you so much for the introduction, Doc. Patient, can you hear us?
You
Patient, can
can.
you? Oh, great, great, great. So, kindly introduce yourself and to our audience.
So I'm patient. So I work control. Ghana has lots of condition, cancer, sickle cell, diabetes, hypertension, and the others. So I also happen to be the focal person for sickle cell. So I'm glad to be in your midst tonight. So we learn.
Okay. Thank you very much, Patient, for that introduction. So, like I said earlier, if you just join us, this is the Good Life chat room of the Ghana Health Service. Tonight is all about sickle cell. So tonight, we are going to dive deep into sickle cell diseases, their prevention, treatment, and everything concerning it. So don't go anywhere. Share the life. Nazar, you are welcome. And our deepest, you're also welcome. Jodiah, you are welcome to the live. So quickly, let's dive through the discussion. Um, like I said, tonight's conversation is not just about diseases. I mean, it's about children who miss schools because of pain, parents who spend sleepless nights at the hospital, and young people living with a condition they did not choose. I hope this is not going to be you. And also families who lives whose lives changed forever because they didn't know their genotype. So whether you are a parent, you are a student, you are planning to get married, or simply you are concerned about your health, don't go anywhere. Tonight could change the way you think about sickle cell diseases. Let's start with the basics. So patients, let's find out what exactly is sickle cell diseases, and why is it such an important public health issue in Ghana, and also how significant is the burden of sickle cell diseases in Ghana today.
Yes, thank you so much for the question. Sickle cell disease is a hereditary disorder that is found in the red blood cells. So this proteins that are found in the red blood cells, and their job is to carry oxygen from the lung to the so in sickle cell disease, and you will
Patient, I don't
find
know. I don't know if
the person will
uh,
inherit two genes.
patient, can you hear me? Can you hear me, patient?
Is my audible? So
Yeah.
I can.
Okay. I don't know if it's my end or your end. It looks
I
like
can.
the line is breaking a bit. So I don't know what you can do about it. It looks like the line is breaking.
Is it better now?
Uh, okay. Yeah, please go ahead. Let's see.
Hello? Am I audible now?
Yes, we can hear you. Please go ahead.
Hello?
Yes, I can hear you. I can hear you. Can you hear me, please?
Okay, okay. All right. So, yes, I can.
Okay.
Okay, so I said sickle cell disease is a hereditary blood disorder where you find abnormal hemoglobin and reduction of it as well. So the hemoglobin is also a protein that is found in the red blood cells. And then their main work is to transport oxygen from the lung to all other parts of the body. And then in the instance of sickle cell disease, we the one is abnormal hemoglobin that has the disease, at least one hemoglobin S. So that have hemoglobins, and whichever code the person is carrying, we should at least see one S in that code. So usually the codes are two. So there should be an S with something else. So that will take us to some types of the genotypes. Again, in a normal, healthy red blood cells, the shape is round and then flexible. And because of the flexibility, it is very easy to go through the blood vessels, sorry. The blood vessels are like a medium of transportation that will carry the oxygen from the lungs to other parts of the body. So the work of the red blood cell is to transport the hemoglobin, it's for the hemoglobin to transport the oxygen from the lungs to the other parts of the body. So in a healthy red blood cell, like I said, the shape of the red blood cell is very round and flexible, but in the instance of a sickle cell patient or sickle cell disease individual, the shape is quite different. So the shape is not round and flexible. In that instance, it is rigid one, and then the shape is like a sickle shape. That's a tool that is normally used in the farm. In simple terms, it also looks like the shape of a banana. Or you can also say that it looks like a crescent moon, like a halfway moon. So because of this shape, it makes it very difficult to move through the vessels because the vessels are quite small. And then once they are moving and then carrying the oxygen to the other parts of the body, because of the shape and then the size of the vessels, they get clogged up at a certain part of the body. So it depends on whichever part they get stuck. So it could happen at the knee, any part of the body. So wherever it happens, that is when the patient will feel these pain episodes. The patient will feel pain at that place because the red blood cells are supposed to move freely to carry the oxygen to the other parts of the body. But in the instance of a sickle cell disease patient, because of the shape one, and then because it is not flexible, it is rigid, they tend to get stuck to each other at a particular point in the body. And then once they clog up, they cause pain to that individual. Yeah, so in simple term, I think that is it. That is sickle cell disease.
Okay. Thank you so much um, for this education. But can you touch a little bit on how significant the burden of sickle cell disease is in Ghana?
Okay, all right, thank you. Yes, it is because annually in Ghana, we record 2% of newborns annually are born with this sickle cell disease. And then the statistics shows that approximately in Ghana, we have newborns around 900,000. So if we are speaking about 2% of this cohort being sickle cell disease patients, then that is, we are looking around 18,000. When you say 2%, it sounds quite okay, because if you are taking 2 out of 100, that should be fine. But if you drill it down to figures, then it becomes very real. And mind you, this 18,000 are human beings. They are realities, and it's not just figures. So every year in Ghana, we record around 18,000 newborn babies with this disease, this sickle cell disease. Again, this cohort of people, the 2%, that is around 18,000. About 50% of them carry the homozygous gene. So that will also take us to some examples of, or some types or forms of the sickle cell disease. So let me quickly run through that so that you get it. So we have the sickle cell anemia. In this instance, the person carries 2 abnormal hemoglobin. The person carries 2 of the S's. So it means that the person is getting 1 S from parent A and then another S from parent B. Then we also have SC. That is the milder form of the sickle cell. You remember I said before someone will be diagnosed of having sickle cell disease, the person should have at least carry 1 abnormal hemoglobin of S. So the SC is the milder form of the sickle cell. For them, they present with milder signs and symptoms comparatively to the SS. So the SS is a severe form of the sickle cell disease. Now we have other forms. We have thalassemia, beta thalassemia, sickle beta thalassemia, and even that we have about 2 of them. We have sickle beta 0 thalassemia and then sickle beta plus thalassemia. So the sickle beta 0 thalassemia has some similarities with the sickle cell anemia, that is the SS. So they present with the same signs or similar signs and symptoms of individuals living with the sickle cell anemia. And then the sickle beta plus, that is also a milder form of the thalassemia group of the sickle cell disease. So we are going back to the fact that the 2%, out of this 2% of newborns who are born annually in Ghana, we have about half of them carrying the homozygous, that is the SS, and that is the severest form of the sickle cell disease, which we normally call sickle cell anemia. And then when they are not screened early, they are not detected early, we don't throw in interventions early, they tend to, visit the facility frequently. They are hospitalized frequently. They come in with a lot of infections. And then the mortality rate among this cohort is also very high. And because of that, it is of public health importance to the nation and then all individuals in the country. Thank you.
Thank you so much. Thank you. So, Doc, let me come to you. But before we even go to Doc, let me find out how many of us here know our genotype. Let us know. Tell us in the comment section. And yes, if you just join us, you can leave your comments, your questions, and everything in the comment section, and I'll ask our guests for us to address them for you. So you can leave your comments in the comment section, and we will address them for you. And welcome to, if you just joined us, this is a Good Life Chat Room of the Ghana Health Service. Tonight we are talking about sickle cell diseases. So, Dr. Abigail, let me come to you. One thing many people still struggle to understand is the difference between having the disease and also carrying the trait. What is the difference between sickle cell diseases and sickle cell traits? And also, why do many people confuse AS with SS, and what should the public understand about this distinction?
Okay, thank you. So, Madam Patient has explained the sickle cell disease as a genetic disorder in the blood where an individual inherits two abnormal hemoglobin from parent A and parent B. And one of the abnormal hemoglobin must be X. So she went on to mention some of the abnormal hemoglobin. So if you say the treat is that in the cell disease, you have two abnormal hemoglobin. So some of the abnormal hemoglobin, we have the C, we have the E, we have the S, right? So if you have two abnormal hemoglobin and one is S, it means you have the sickle cell. The SS, right? And the SC, those are the most common ones we have in the country. But an individual with the sickle cell trait, it means you have only one abnormal hemoglobin. So it means that, let's say you inherited the normal one, which is the hemoglobin A, and then an abnormal one, which is, say, the hemoglobin S. So we can have AS. So those with the sickle cell disease have two abnormal hemoglobins, and one of them is S. And those with the trait, they have only one abnormal hemoglobin. So why do people confuse the two? The reason is that both of these traits, they contain the hemoglobin S. So for some people, when they see the hemoglobin S, they assume it's a sickle cell disease. And another thing I want to highlight is that for those who have the trait, we usually call them the carriers, who have one normal hemoglobin and one abnormal hemoglobin. Most of them go on to live normal lives without any crisis. However, if they meet another individual and they want to become parents, and that individual also has the trait, that is when they can give birth to a child with a sickle cell disease. So here we are saying that those with the trait or the carriers, most of them go on to have normal lives. They don't have any of the sickle cell crisis or complications we know or we'll be talking about. However, if they marry or they give birth with another individual with the trait, that is when they will have the child can inherit two abnormal hemoglobin, and then that child can have the sickle cell disease. So in the disease, you have two abnormal hemoglobin. One of them is S. The trait, you have one normal hemoglobin and one abnormal hemoglobin. Thank you.
Okay, thank you very much, Doc, for the explanation. Kindly leave your comments and your questions in the comment section, and Doc will address it for you if you have any question or if he could be you or a family member or anybody or any question at all, you can just drop them in the comment section and we will address them for you. Patient, let's find out. Knowing your genotype can be one of the most important health decisions you can ever make. And a lot of people, I don't know the percentage though, but I know most people, they don't do the testing, or they don't know their status. Why is it important for everyone or someone watching right now to know their genotype before marriage or even having children? Patient, can you hear me? You can unmute and talk.
Yeah, I dropped off and then I just reconnected. Please, can you
Oh,
come again with the question?
yes. So I was saying that many people in Ghana or even beyond Ghana, but we are in Ghana. So many people in Ghana don't know their genotype status, and we know that knowing your status can be one of the most important health decision you can ever make. But we want to find out, why is it important for everyone to know their genotype? I mean, before marriage or even having children.
Yes, okay. Thank you so much. Yes, so it is very, very critical for every individual to know their genotype, especially before marriage or before childbirth. This is because genotype, that partner, you can make healthy reproductive choices. When you get to know, then you pair and then you see the possible outcomes of children that you could bring up, then you can decide whether you carry or not. That will give birth to who will have sickle cell disease, because it comes with a lot of burden. It comes with socioeconomic impact. If you have a child who has sickle cell disease and then you have to run frequently on admissions, it means that if you are working and then you would have to go on admission almost every month, then it means that it will cause low productivity, one, and then it also brings burden to the healthcare system. Are going in and out because you would sometimes they may have to get blood transfusion, they may have to be put on pain medication, and then to the extreme, sometimes they do bone marrow transplant. So it brings burden to the healthcare system. And then the quality of the life of the patient, if you should bring out a child with sickle cell disease, it is quite burdensome. It also interrupts the education of the children as well. And then the socioeconomic impact. Sometimes we have the hydroxyurea on NHIS anyway, but because of issues with the level of prescription, sometimes they need to purchase it out of pocket. So because of all these burdens, you want to get to that extent to incur upon yourself and then your partner all these challenges. And because of that, it is very, very vital for you to know your genotype and that of your partner before you take a decision on marrying or giving birth, just so you don't give birth to a child with a sickle cell disease. Yeah.
Okay. Thank you so much. Like I said earlier, if you have any question, you can drop them in the comment section, and we will address it for you. Um, a follow-up question. Can you explain some of the common genotype combination and the risks associated with them. If you can touch on this for us. Patient, you can unmute and talk.
Okay. All right. Thank you. Various types of this genotype. Let's use the commonest one and then try to understand it. So, have parent A having AA, or let's say AS, and then parent B also having AS. So both parents have genotype AS. So the child or the children they will bring forth we could have the probability. So this one is particular with each pregnancy. I think over the years we have believed that these probabilities are associated with the number of children you have. So with ASAS, there's a probability of that pregnancy or that child coming out to have a genotype AA. That is about 25% probability of the child coming out as AA. And then 25% probability in an SS, and then 50% probability of the child being A. So each pregnancy and not the number of children. So in this instance, someone can say, okay, then it means that if you decide to have 4 children, it can be AA, the other can be SS, and then the other 2 could be AS. No, that is not it. So this probability is about each pregnancy. So if parent A, the mother is AS, the father is AS, and then you decide to get pregnant and then give birth, that pregnancy or that child, there's a probability of that child having a genotype AA, 25% probability, and then 25% probability of the child having SS, and 50% probability of the child having AS. So this is what we do. If the mother is AS, the father is AS, you just try to do a cross up. So you take the A and then take the other A of the parents, then you have AA. Then the same first A, then the other S, you have AS. Then the second A of the first parent, the parent A, you pair it with parent B, A, then you have another AA. That is how come the AA is 25% probability. Then you also take A and then pair it with the other S of the other parent B. Then you have AS. I hope it is clear, like it's shown on the screen. So I'm trying to explain the first one. So parent A is AS, parent B is AS. Now we have probability, 25% probability of that pregnancy coming out with B, then 25% probability of SS, and then 50% probability of AS. So it comes with each pregnancy and not the number of children you will have. I hope it's clear.
Yes.
So this is a typical example of combination you could do. You could also apply the same rule to the others. If you have parent A as AS and then parent B as SS, it means that the probability of that pregnancy coming out with SS is even more higher than AS, because you have parent A being AS and then parent B being SS. So once you have the genotype of both parents, you can just do the cross matching and then you have the probability chance or the chances of that pregnancy or that baby coming out with a particular type of genotype.
Okay. Uh, I know somebody is sitting down there wondering all this. So let's make it simple for them. So we have AA.
Yes.
We
I
have
don't know if you could zoom the first picture.
okay.
Is it possible to zoom in the very
Yes.
first column? Okay. Just okay. All right. So this is it.
Okay.
Parent A is AS. Parent B is also AS. So if we are doing cross matching, it means that we are taking the first A of parent A
Okay.
to match the first A of parent B.
Okay.
You get it?
Yeah.
Then the second probability will be the first A of parent A, and then the second figure, that is S of parent B.
Okay.
Then the third one will be the S of parent A matching with the very first letter or code of parent B. So that will be SA, but we don't say SA, so it will come back to AS. Then the fourth matching will be the S of parent A to the S of parent B. So once you take one letter from one parent or one code, you match it with the very first one of the second parent. Then the first one, you come back and then match it with the second letter of the second parent. Then you do likewise to the second letter of the first parent.
Okay.
Then you get 4 probabilities. Then the codes that come out will tell you the chances of that pregnancy, the genotype that that child may carry. So like we are seeing here, the first one is SS, which is coded S. It means that this child, the probability of the child having SS is 25% because it's just one. We are just seeing one SS in this field. So the second one is AS, the third is AS. And because we have 2 of the AS, that makes it 50% because we are looking at 4 probabilities here. I hope it's clear.
Yes.
And then the fourth one is AA. That is good because it's green. We all know red, gold, green. Red means danger. Gold or yellow means that it's quite milder. And then the green is good. So that is how we do the pairing.
Okay.
So you have to screen and then know your genotype, and then you know that of your partner's own. You can and then do the matching, and then you'll be able to tell if you decide to get pregnant now, the probability of that child coming to whichever genotype, you'll be able to know, and then this will inform you to make the right reproductive choices or decisions.
Okay. So now let's go to the let's touch a little bit on the matching bit. So let's say I am AS and my partner is AS. It means that we cannot, for some reasons, we have to advise ourselves, right?
Yes. So in this instance, if you should get pregnant now, the probability of that child coming out as an SS is 25%.
Yeah.
And 25%, AA is 25%, AS is 50%, because we are seeing 2 of them there. That doesn't also mean that the higher the percentage or probability the lower your chances of having that child, or the higher your chances. Anything can happen. So once it's a probability, anything can happen. When the formation is happening, come out. So it is for you to, decide
Decide.
whether you would want to move on and then, yes,
Okay.
have a
Someone is asking. So how do we the question is not clear, but the person is trying to find out how you can match with each other. So is if I am AA, does it mean I can marry someone with AS? If someone is AC, like you explained that one, who they can match up with?
Okay. So AA and then AS. So when we try A, AS, AA, and then AS. So it means that the probability of each pregnancy coming out as an AA is that pregnancy coming out as an AS is 50%. Now, if the child, yes, the child should come out as an Riley explained, it means that that child has sickle cell trait.
Okay.
So the worst we could have out of an AA and then an AS is the AS. That is the worst we could have, because the 50% of that is AA and then the other 50% is an AS.
Okay.
And in that instance, the child will be a carrier carrying one abnormal hemoglobin. That
Okay.
is the S.
So
But that child will not necessarily be as a sickle cell disease patient, or will not carry the disease itself, but that child will be a carrier.
okay. So right now, let's say we are clear on the children bit. Now we want to get married. Who should we marry? Like, who should we be compatible with? Compatible with who? I think that's what the person wants to find out. So
Okay.
I understand
All
that
right. So I think you can.
if you are AA, you can marry anybody or anyone in the genotype circle, if I'm not mistaken.
Yes.
Okay. So which
So
other
if you
one?
are an AA and then you are marrying anyone, any other person, or anyone carrying any other genotype, it means that because of your AA, the worst you could have is an AS.
Okay.
That is, if the other partner has any abnormal hemoglobin S, then the worst, whether SS, AS, SE, that you have is the AS. That is one that is a carrier that has sickle cell traits.
Okay.
But again, we should remember that once you have once that child is a carrier, it means that the tradition will go on. If that child is ready to marry or give birth, it means that he or she must also take into consideration whoever the partner, or whatever the partner's genotype is, just so they don't give birth to a child with a sickle cell disease.
Okay.
Because once that baby or that child is carrying the abnormal hemoglobin S, whoever they pair with, if that person also at least is carrying abnormal hemoglobin S, then it means trouble is at the corner. You might have a child with a sickle cell disease. Yeah.
Yeah.
So we should be cautious. It's very simple to work it out. Once you have genotype for parent A and then parent B, you just try to cross it. You take the first code and then match with the first of the second parent. You take the the first and then match with the second, just like that. Then you come back and then take the second and then match. You make sure that you match with the 2 so that you get 4 fields. Once you get them, you now know you have established which one is a normal genotype and then which one is a trait and which one is an abnormal.
Yeah.
So you'll be able to take your right decision.
Okay. Thank you so much. Ketre, you're welcome to our live. Bisab Jews, you're also welcome. Godfred, David, we have Emmanuel here, and Francois. Francois, that's the president of Sickle Cell Support Group of Ghana. You are welcome to the live. Esther J, yeah, I see you. Esther J, welcome to the live. Is it Sami Fix? You're also welcome. And Mami, Mami Nyama. Is it Nyama? Yeah, you're also welcome to our live. SKMD. You're also welcome to our live. This is the GoodLife Chatroom of the Ghana Health Service, and tonight we are talking about sickle cell diseases. Yes. So if you have any question with regards to sickle cell diseases, let us know in the comment section, and I'll read it to our experts to answer them for you. Doc, huh. Let's talk about early detection, because timing can make all the difference. So let's talk about early detection. What signs and symptoms should parents and caregivers never ignore when it comes to sickle cell diseases?
Okay, so I want to make this disclaimer. We never recommend that parents should find a sign before they take the disease serious. And this is supported by the current Ghana National Strategy on Sickle Cell Disease that is supporting newborn screening. So ideally, every newborn should be screened for the sickle cell disease. And we don't encourage the parents to rather, after birth, take the baby home. Then when the signs and symptoms start coming in before we do diagnosis, we want to diagnose and start our preventive treatment before the complications come in. But let's say your child is already diagnosed with the disease. These are some of the signs or symptoms you should never ignore. The most common one is fever. Okay, I don't want to say the most common one. I want to talk about fever. If you're a caregiver or a parent and you have a child living with sickle cell disease and the child has fever, so that's high temperature, you should take it very serious, because in such individuals, they could be a sign of an infection and that can worsen very quickly. So if a child living with sickle cell disease has fever, you should seek medical attention promptly. Another thing I want to talk about is pain, moderate to severe pain. So you have a child who has sickle cell disease, starts complaining of pain. Usually we encourage the caregivers or them to give me paracetamol, sometimes brufen, and then the pain is not resolving. That is an indication that you should go to the hospital urgently. Another important sign is if you notice that your child with sickle cell disease is not breathing properly, struggling to breathe, or breathing too fast, or even complaining of chest pain. These could be signs of a very severe complication called acute chest syndrome. That's also something you should take very seriously. And for the infants, that's babies below age 1, if you notice that, especially those who have not been diagnosed yet, the hands or the feet are swollen, you should take it serious. Not just that, if you also see that your child who is living with sickle cell disease is having the abdomen or the stomach is becoming big, that could be a sign, that is a sign that you should also not ignore. Or you notice that the child's eyes are becoming very yellow, or the is becoming yellow. sign. That is also a sign that you should also take very seriously. I also want to mention that I'm trying to explain paleness, but for those who are not clinicians, if we say a patient is pale, it's usually a physical sign that we can use to say that this child may possibly have very low HB or anemia. You may not be able to see, but I think for most parents, they know their children very well. They can tell that, oh, the eyes have become very white, or the hands are becoming very white, or the very consistent one that all of us can really detect very fast is you notice that your child is getting tired more frequently. That's also something you should not take seriously. So going over all the things I've said, I've mentioned that we don't want the children to start having the symptoms before we diagnose them. So we want to have like the National Strategy of Sickle Cell has said, newborn screening. So every child born anywhere in Ghana should have the sickle cell test done for them. If your child has already been diagnosed with sickle cell and the child is having fever, pain, struggling to breathe, or chest pain, so pain can be anywhere in the body. Eyes are becoming very yellow, child getting tired frequently, or the child is having swollen hands, especially for those less than 1 year, swollen hands or feet, or the stomach or the abdomen is becoming big. These are the things we don't want parents to take for granted. For children living with sickle cell disease, we don't encourage parents to go to the licensed chemical shop to get over-the-counter medications for them when they are unwell. We always recommend that they come to the emergency unit, and then we will assess and treat appropriately. Thank you.
Thank you so much, Doc. Somebody, okay, we will come to testing soon. Then we can address this question. Somebody is asking if testing is free. Um, oh, sorry. Doc, yes. Thank you very much. Somebody is asking of testing. I'm sure you touch on testing when we get to treatment. He's asking Emmanuel. Yes, Emmanuel wants to find out if testing is free of charge in Ghana. But Doc, let me find out. At what age do symptoms usually begin to appear, and why is early diagnosis very important?
Okay. So when before you are born, while in your mother's womb, the type of hemoglobin you have is the fetal hemoglobin. This type of hemoglobin has a very high affinity for oxygen. So they're able to attract a lot of oxygen because the rate at which you need to grow in your mother's womb within the 9 months of pregnancy is very fast. Now, when you come out, the fetal hemoglobin or hemoglobin F is supposed to go down so that you get the adult hemoglobin A. However, for a lot of children or for a lot of us, it takes about 4 to 6 months before this fetal hemoglobin finally leaves your system. So even if you have two abnormal genotypes, so you have the SS, but because your fetal hemoglobin is still available in your body, that's a very high, it's able to carry a lot of oxygen, that you are likely not to have the symptoms. And the symptoms will only begin to show when they have finally left the system, and that's around age 4 to 6 months. So that is when we see a lot of our babies coming in with symptoms, and the common ones are, we call it hand syndrome. So their hands and their feet will be swollen. And for those who don't have the knowledge that this could be sickle cell, they'll bring them pain medication, applying things for the swelling to go down. Or it could also be a baby who is always having fever. You go in, they tell it's an infection, it keeps coming. I mean, recurrent fevers. Now, the next question is, why is early diagnosis very important? it is important because we want to start preventive treatments before these complications begin. We don't want you to come in with an emergency before, as part of our assessment or as part of our management, we test for the sickle cell disease. So the main is to start the preventive treatment before the complications begin. Fortunately, that we have children as old as 3-4 years living with the disease, and they come in with very severe complications. Some even have stroke from the disease, and that is the time we are finding out that they have the disease. In this era and age, it is highly unacceptable that children or babies skip through the healthcare system without being diagnosed. I mean, for those who have the condition. Thank you. Hello. Hello.
Yes, Doc. Thank you so much
Okay.
for this information, and let's let's talk about um, okay. Now let's talk about um, the patient. Are you there? Are you with me?
I think patience is not on.
Okay. So then, Doc.
I think she's dropped, but you can go ahead and ask the question.
Exactly. The good news is that many complications can be prevented. I mean, if you manage yourself well, for people living with sickle cell. So, what can uh, they do to stay healthy and prevent complication, Doc? If you can touch on this for us.
Okay, so we have various forms of treatment for those living with sickle cell. So we have the disease modifying treatment. And in Ghana, we use the hydroxyurea. So what it does, we give it to those with a very severe form of the disease. What it does is that it helps you, it reduces the number of crises you have. And then we have the preventive or supportive care. We give that, so that includes managing pain, giving blood, giving folic acid, and then we have the curative. That is where your blood is produced in your bone. We call it in the bone marrow, like the inner parts of the bone. So they're able to give you another marrow that does not have the sickle cell. So these are the various forms of treatment. Now, if you have the sickle cell disease after diagnosis, you'll be enrolled in a local clinic. So at the moment, Ghana is trying very hard that even from our CHIPS compound, primary health facilities, secondary, tertiary to our quaternary services, we should be able to have a sickle cell clinic so that individuals living with the disease can go for regular checkups and follow-ups. So the first thing we do after you've diagnosed you with the disease or your child with the disease is to counsel you, make you understand the disease, possible complications, and the medicine we have to give you. After that, you are enrolled in a sickle cell clinic, where depending on the severity of the complications in the past, you are to come in monthly, every 3 months, every 6 months. So that is very important, regular clinic follow-ups. And then we give them, I mentioned some of the medications. So for those with the very severe forms of the disease, especially those with S, you come on hydroxyurea. Hydroxyurea too, we are advocating that it's really available and accessible in all parts of the country. Hello?
Yes, I can hear
Hello,
you.
please, am I being heard?
Yes, I can hear you. Please go ahead.
Okay. Hydroxyurea is accessible and available in all parts of the country. And from the beginning, Madam Patient mentioned that though it's on the National Health Insurance, sometimes it's not available and parents must buy out of pocket. So the hydroxyurea too is also very important for those who are already on it. We also give them folic acid supplementation to also help them. We also give them, recommend some certain vaccines for them because they are at risk of certain infection because their spleen usually does not work optimally. For almost all those, for those under the age of 5, they are also put on prophylactic antibiotics. So that's the clinical part, regular follow-ups, and then making sure that depending on the severity of your condition, you are on these medications. And for selected patients, we may give them the stem cell transplant, which is supposed to cure the disease. But for some, not all the patients may qualify for that. And also, it also comes with a lot of risks. So we have to do a very important case selection before we recommend that for you. Now, that's the medical part. There's also it is also very important that as a caregiver, if you have a child living with sickle cell disease, that child eats a healthy diet. We all know the importance of balanced meals, but for these patients, it is very critical that you make sure that they are eating healthy foods that are rich in vitamins and minerals and proteins, because the disease is such that they are at risk of infections, and it can also affect growing. So what you can do to support their bodies is to make sure that they are eating very well, balanced meal. So give them a plate of meal and it's all colorful because all the food nutrients and essential minerals are on the plate. Another thing that we also encourage the parents ensure the children or these patients who are listening to me are taking enough water. When they don't have enough water in their body, which we call dehydration, it can also lead to crisis. It can precipitate crisis. So we always want them to hydrate. So depending on the age, the weight of your child, we may give you a recommended amount of water to drink every day, and we want parents to be very compliant. So I mentioned that you have to attend regular sickle cell clinic follow-ups, take all the recommended or the prescribed medications daily and be compliant, adequate or balanced nutrition. Then you also make sure that, and in conditions like, now we are in the rainy season, the weather condition, the cold can also precipitate crisis, painful crisis. So you make sure that they are in warm clothes and their bodies are not exposed to the environment. Yeah. So these are the main pointers I want to address.
Okay, thank you so much, Doc. Doc, please, can you touch a little bit on the food they can eat and the food they can avoid? I mean, if you can touch a little bit more on this, we'll be very grateful.
Okay. So foods they can eat. We are aware of a balanced meal. We don't want them to take in a lot of sugar sweetened beverages or energy dense foods without proteins and minerals. And for the foods they can eat, it's age specific. In pediatrics and child health, we don't have a homogeneous group. Every age group and what they need. So let's say for a 6-month-old, you want to give breast milk, and also you want to also add complementary feeding. So it will depend on the child. However, if you're a parent here and you're having issues with the nutrition of your child, I will recommend that you go to your primary care, then your clinician can recommend you to see a nutritionist. But then I want to tackle or mention some general principles. For every plate of food you are giving to your child, there is the carbohydrates, those are the energy giving foods. Then the proteins, those are the bodybuilders, and then the vitamins and minerals. These are essential for cognition, for the brain development, to fight infections. And a typical Ghanaian meal of, let's say, rice, right? You can give plain rice, right? With, let's say, kontomire, with agushi. And this is actually a balanced meal because the rice is giving us our carbohydrates. The kontomire contains vegetables, some healthy oils, and the agushi is protein. Even in people who want to even garnish it, even add a boiled egg. So that is how a healthy balanced meal may look like. But we don't want the child to be eating one particular meal, which is just energy dense, these sugar sweetened beverages, no fruits and vegetables. For children who are below 1 year, you can introduce fruits to them to also help them get more vitamins and minerals. So you can mash them for them to, I mean, we don't usually recommend you juicing them, but then you can make them like mash them mashy, let's say banana, you make them mashy so that they can mumble on it and eat. So the exact or the nutrition recommendations are age specific, but then the general principles are the same. Make sure that you are giving balanced diet. But if you want a personalized nutritional care or nutritional support for your child, I recommend that you go to your primary care center, talk to your clinician, and then you will refer to the diet therapy unit for a personalized diet plan.
Okay. Thank you so much, Doc. Let's stay with you. I know we spoke up. You touched on treatments a little bit earlier, but if you can talk a little bit on more on it for us. What treatment options are available today for people living with sickle cell, and also how have advance in treatment improved the quality of life of patients over the years? Briefly.
We've actually made a lot of advancement when it comes to the sickle cell disease. In around the 1970s, the average quality of life expectancy for individuals living with sickle cell was like, I think, an average of 14 years. And now we are seeing a lot of children who are surviving into adulthood. It's not uncommon to meet an entrepreneur, a doctor, medical scientist, business CEO living with sickle cell disease. I think this actor and popular man in the entertainment industry, KSM, came out to talk about his journey with sickle cell disease. So it means we are making a lot of advancements in the disease case management and treatment. With the various treatment modalities, I mentioned them briefly, but we'll go over them. We have those that modify the disease. And in Ghana, we have other types. We have approved the hydroxyurea to be given to all patients who are living with the condition with the severest form of the disease. So it's not every patient with the disease who will be put on that. And that particular medicine will help reduce the number of crises you have or the number of complications you have. And I've seen countless number of patients who are compliant on this medication. Let's say they started in our clinic having a lot of issues, but the moment they started on the hydroxyurea, being compliant, the complications drastically reduce, and these children are able to make it to school, they are living their best lives. Another medication we usually the children living with sickle cell disease is the folic acid supplementation. It's like a form of supplement that also helps you to also have like it also supports your red blood cells. And Madam Patient mentioned that in sickle cell disease, your red blood cells, they have abnormal shape like the banana or the sickle that is used to harvest rice, and they are very hard, making them not function optimally. So the folic acid supplementation also helps. And for children below 5 years, we put all of them on prophylactic antibiotics to also reduce the incidence of infections in this age group. So these are the treatment modalities we give to almost all the patients living with sickle cell. And then the one that can cure you, I mentioned that's the transplantation. Sickle cell disease, and depending on your disease, you are on these medications. You are eating a balanced diet, taking in water, or clinic checkups and follow-up. You are likely to have reduced number of crises or milder complications. These hospitalization drastically reduced. So this is how we treat the sickle cell disease. I don't know if I've answered all your questions.
Yes, you have, and thank you so much for this insightful education or information. If you just join us, this is the Good Life chat room of the Ghana Health Service. Tonight, as we do every night, every Friday, I'm sorry, not every night, every Friday, yes, every Friday evening from 7 to, yes, from 7 to 7 going, we come on live here to discuss about some of our interventions we and the programs we have in the service. And tonight we are talking about sickle cell diseases to commemorate World Sickle Cell Day. Yes, today is World Sickle Cell Day. Every 19th June, we celebrate people living with sickle cell and give information on it. Today, we had a very fruitful conference at Tan Palace Hotel here in Accra, and it was very amazing, very insightful. A lot of people came, and people living with sickle cell sharing their experiences and all. One of um, the the caregivers that really touched my heart. She was very unfortunate, and she lost her daughter. Yes, she lost her daughter. I think her name was Amy or Emma or something. Yes, and her daughter was Zita. She lost her at the age of 19 years old, and when the daughter was sick and all, she was an accountant, and she had to quit her job and go to the market and sell things to be able to take care of the child. And I mean, unfortunately, she so lost the child at the age of 19. So this disease is very dangerous, and I'm really, really concerned. And it's good if we advocate for people to know their genotype and then also share their experiences for other people to follow. I think it will be very good. I am looking for Celine. Celine is not here, but Benita. Benita, can you hear me? Okay, so whilst we wait for Benita to join us so that she can share her experience with us, let me. Yes, Doc, somebody asked a question earlier. Is testing free of charge in Ghana? And for how much? If it's not, how much is it? If you can answer this question for us, you'll be grateful. Doc, can you hear me?
And I think that but newborn period, you have to pay for the sickling now. We usually recommend just the HB electrophoresis because that will actually give you the various your genotype. So the HB electrophoresis. And it depends on the place you are doing it, whether in a government facility, a private lab, a private hospital. So yeah, it depends on the facility you are doing. But I want Madam Patient to come in with this
Okay.
question.
Okay. Yeah, so like she said, we are praying and then, hoping that we'll get there. We'll have a nationwide mandatory
Comprehensive
newborn
newborn
screening.
screening.
Yeah. But as it stands now, it is not. So quite a number of facilities do charge for these screenings. Apart from that, so it depends, like you said, it depends on the facility and then, the rate at which they are charging for the screening. It will also depend on the type of screening
You are doing.
because we
Yeah,
have different test
type.
kits. We So when it comes to screening, we could have the hemotype SC, we could have the sickle scan, we could even have the gazelle
Yes.
or screening. When it comes to, so after screening, we need to go further and then do confirmatory tests. So we screen and then we have, let's say, band SS or AS or AC. We need to go a step ahead and then do a confirmatory test to, like Doc said, electrophoresis, to tell us what exactly you are carrying, so that if we need to put you on treatment, we'll know the exact thing we need to do for you. So for now, it is not free.
That's very
Not
smooth.
that something, yes. I think the free primary health care is capturing all these things, doing screening and health education and counseling and all that are part of the package. And then we hope that it will be free once they start enrolling. As it stands now, they are piloting a few facilities. So once all facilities are involved in this package, I hope
The
that the
newborn.
screening will be free.
That
But as it
you want
stands
it
now, it is not. But we also have a number of projects running. So recently we had Clinton
Health initiatives.
initiative, that's Chai, supporting Ghana Health Service with some commodities, so screening commodities and then confirmatory tests like the Gazelle, to support a few facilities in screening. The target is under 5 for tests. And yes, so for adults, I think if you have yet and you want to, it will go at a cost.
Okay.
Very expensive. So please go and the last time I did mine long ago, and some years ago, I organized screenings for when I was in medical school. So this was like 2018, 2019. And at the time, I think it was like 60 CDs. So I don't know. Even if it has gone up, I doubt it will be more than 200 CDs in government facilities. I mean, private facilities may charge different. So please, it's worth it. We've already established the fact that it's a very simple health decision, but then can really change the trajectory of your life. So
Yeah.
please, yeah, health is important. Let's go ahead and then get tested in no argument time.
Okay. Um, Fortunately for me, I mean, the one who did for me was okay. I knew the person, so I mean, he did it for me for free. That was around
Oh, okay.
20, I think 2021 thereabouts. Yes, 2021, 2020 there. It was when we got old or older. That's when we decided to find out our status. But I mean, it's good. It's good for everybody to know their sickle cell status, and it will help you and your partner, and I mean your future children to also um, make I mean healthier, to have a healthier children. Uh, um, so Madam Afra, I can see you. Yes, welcome to our life. I see you. Shati, yes, I see you. Welcome, welcome to our life. And Posh is saying that this is very educative. Yes, I mean we are here to educate you on all these things so that we have sickle cell disease free in Ghana. That is the aim. So yes, that's why we are here to educate you that you at least you should know your status before you decide to have children or you decide to get married. Kindly drop your comments in the comment section, and if you have any question or comment, just drop them in the comment section, and I'll ask experts for them to deliberate on it for you. Adam, you are welcome to our live. So very soon we'll be drawing the curtains. But patient, let me ask you. Oh no, in fact, let me start with Doc. Doc, you interact with a lot of patients coming to the clinic and all. Can you share some of the stories you've heard with us? Some of their stories. I mean, some patients, or let's say, yeah, let's you deal with the patient, then maybe patient can deal with the caregivers and talk about it. But share with us some of the experiences, some of the patients through your interaction with them, how their daily life is, and all. Maybe we can take one or two, um, yes, from it.
Okay. Okay. So uh, a day in the life of a patient with sickle cell can be just a normal day, like can be same as a day of somebody who is not living with the disease. And how to complications can actually, I meet patients who have had no crisis in like 2, 3, 4 years because they are very compliant on their medications. They are doing well. So these are some of the success stories I hear. And some of the patients are making it to higher educations, they are working, some are even raising families. So these are some of the success stories. And when we talk about, not just to focus on the crisis and fears behind the disease, and the fact that those people with aspirations, dreams, and they can live in life. Another story I want to share is a parent, or not just one, a number of families who have 3, 4 children, and all the children have sickle cell disease. When patients was trying to explain the matching, she mentioned that if both you are AS, your partner is AS, and you have a child, the child has 25% chance to become or to get S from each parent, getting the sickle cell disease. And this 25% applies to each single pregnancy. So if you get pregnant today and you are AS and your partner is AS, your child has a 25% chance of getting the disease. And it can be that for all pregnancies, that the children are going to come out with the disease. And I've seen parents or families like that, where all their kids, 3, 4 children, all of them have the sickle cell disease. And it's quite heavy on them. I've also met teenagers who are having psychological issues. They are having challenges even being compliant, and for such, we usually recommend them for professional psychologists to deal with them. So the stories are a lot. And some also, they genotype families, I mean, a couple, they knew their genotype, they were hopeful. And when it comes to this disease, hope does not really, hope is not the answer, but an informed reproductive choice is the answer. They went ahead hoping their first child was SS, they tried again SS, and unfortunately now there is a broken home. So the stories are a lot. But what I learned from my encounter with individuals living with sickle cell is that they are very resilient, very, very resilient, because they encounter challenges at a very young age. And they also have emotional intelligence. Their threshold to pain can high because they've had, for those who were not diagnosed early, they didn't start preventive therapies early. They came in after they've had serious or multiple crises. Their pain threshold is low. And they also have increased awareness. Some of the children don't And the last thing I want to share is that for a lot of these patients or children living with sickle cell, individuals living with sickle cell, they teach all of us that you should not be defined by your circumstances, because you see them still smiling through the disease and the pain, still trying to live their best life. So these are some of the stories I want to share with our listeners or our
Okay.
viewers today.
Thank you so much. Doc, please don't go yet. Today at the conference, one of the speakers
Okay.
um, did mention that he was it AC, but miraculously, I think it was either AS, then miraculously it was changed to AC. Can it happen like that? Like, can your genotype change, and how does it
Okay.
happen? Yeah.
Okay, so I'm talking as a scientist. We don't have anything like your genotype is changing unless you've done stem cell transplant or the bone marrow transplant. So
Okay.
in science, there is nothing like your genotype is changing. However, it's human beings that sit at the machines that do the test. It could be that the first test that was done was a mistake. And no test has 100% specificity or 100% sensitivity.
Yeah.
So most of them, the very good ones are like 95, 98%. The 2% can be you. So that's what I believe. There is nothing like your genotype changing unless you've done the bone marrow transplant. So it could be that the first test was a mistake, and maybe the second was actually the real result, or even the second one is rather it's a mistake. So
Yeah.
that's what I can say. In science, we don't have anything like your genotype has miraculously changed. No, it doesn't happen like that. Yes,
Okay.
I've actually met. I had a couple friend. They first before they started dating, they are both in the medical profession. They are clinicians. They did their genotype testing. They did it, and it came back. I think one was AS. I think the man had already always known that he was AS, but the lady's own came as AA. I think that was why he pushed the lady to do it. Now the lady was traveling and or something, and as part of the medical she was supposed to do, she was supposed to do the genotype testing, and it came back as AS. She ended up repeating in like 5 different facilities, and it was the same. At the end of the day, they made the decision to go their separate way. So it could be that the first one that gave her A was actually a mistake. People can even swap results. I mean, that's not the best, but we are humans, and humans, there's that human error somewhere. You've done the correct testing, and then you give someone. So all these can attribute to this change, but in science, there's nothing like miraculously
Yeah.
change in genotype. Nah.
Okay. Posh is asking. My uncle lost two of his children to sickle cell diseases. The boy was SS and the girl was SC. The girl was okay until she got pregnant. Can you please ask Doc to educate us on living with sickle cell and pregnancy?
Pregnancy. Okay, so pregnancy is actually a physiological state that puts a lot of stress on your body.
Yeah.
Because when you get pregnant, it puts a lot of stress on your heart. Because not only are you pumping blood to yourself, there is a human being growing inside you. So people say that pregnancy actually makes you know your real health because it stretches the body. So for patients with sickle cell disease, when they are pregnant from day one, it is high risk. And sometimes before they even get pregnant, they are supposed to see their gynecologist or obstetrician gynecologist do a detailed and a comprehensive preconception care. And this story is not it's not new. I've actually come across or I've heard stories, even treated patients with the disease, and unfortunately, a lot of these ones. So if you have the pregnancy is already stressful on even those who do not have the disease, how much more the sickle cell disease. But recently I came across stories. I had to attend to a set of twin, and the mother had the sickle cell disease. What she did was that she is SS, the partner is AA. She decided to use a surrogate for her babies. Because
Oh.
the sickle cell disease and pregnancy is very risky. So before you undertake that journey, I encourage you, and I would want you to actually speak to a professional before you encourage that journey. And ideally, such pregnancies are managed at least at the secondary level facilities, the regional hospitals or the tertiary facilities. There was a woman who lost her life during pregnancy, and when I heard the story, she was being managed in actually a primary care center. you have to be managed in a place that has an ICU, that has a NICU. I don't know if you understand. That
Yeah.
have 24/7 emergency services for pregnancy care and delivery. So that's what I can say. Pregnancy is already stressful
Yeah.
for everybody, every woman. It's a very stressful and critical condition. So it makes it very hard for those living with the condition. Not to say that we've not had people who have gone through pregnancy with the disease and survived, but the stories or I've heard about such, journeys have not been one that are good.
Yeah.
So if you are here and you want to undertake that, especially for a woman, you can employ the options of surrogacy. You use your egg, your partner's sperm. That one, your baby is ready and go for your baby. But it's not everybody who can afford, and some to traditionally they will still want to. You talk to your gynecologist before you embark on such a journey.
Okay, Doc. Thank you so much. Team Wise, you are welcome to our life. And Smart Wife, you are late today. Welcome, Doc. During my research to this, I came across an article that talked about some medicine that you can take if both of you, assuming both of you parents are SS. I mean, I think it's an injection that you can take before, it's either, I think, before you get pregnant, so that it will prevent your children from getting the sickle cell diseases or an abnormal genotype. How true is this?
Yeah, the only advanced medical way you can do this is through IVF, where they do egg and sperm selection. But for a medicine that you would take, so that, because you see, when you get intimate with a partner, you all know the story of the semen, the sperms running, and so you can't choose which one gets to the egg to fertilize it.
Yeah.
The only way to do that is to do it inside the test tube. That's the IVF. But for a medicine that you can take so that your gene or your body automatically selects the A genotype, I'm not aware of anything like that.
Okay.
Maybe, medicine is advancing. It could be some of these clinical trials that are now sprouting up, but they haven't reached Ghana yet. So
Okay.
please, if you are a career and your partner is a career, please, you can go ahead and marry. Marriage doesn't necessarily mean you're going to have children, but then you need to be cautious and make sure that you are making an informed, productive choice
Okay. Brightling,
so that you save yourself from a lot of issues.
thank you, Doc. Thank you so much. Brightling, if you are here, kindly give me a thumbs up. Then I can invite you to the live. Doc, I have a question. Patient, I hope you are still around. I have a question for you. Somebody wants to find out what Ghana Health Service is doing to eradicate this sickle cell diseases. So, patient, if you are around, can you touch on this for us?
Yes, so I think we developed national strategy for sickle cell disease,
Yeah.
and then in the strategy, one of the objectives was to improve the health outcome of the patients living with sickle cell disease, and one of the steps is to build the capacity of the healthcare workers. Of course, if we, the healthcare professionals, we don't understand the disease, we won't be able to contribute enough to this. So, about 2-3 months ago, we embarked on this healthcare worker capacity building across the country. Of course, if we have partners coming in to support the service, it is not possible for them to, train all the 16 regions. So normally they happen to select some districts or some regions. So they were selected regions. I think about 11 regions out of the 12. And we are implementing this project in these regions. Like I mentioned earlier on, that there are free screenings for under fives. So these are ongoing around these selected facilities, Greater Accra, some selected facilities, even in Greater Accra, Eastern Region, Bono, and the others. The next one is the newborn screening. Ghana hasn't reached there yet because some facilities are even struggling with test kits and reagents. You know, it depends on which screening kits you are using. And then, like I said, after screening, you need to go a step further and then do the confirmatory test. And then that is quite costly because depending on which type you are using, if you are using, now we have the point of care testing, even with the electrophoresis, when you want to confirm whether you are you truly have sickle cell disease or not. They are quite expensive. So we are supposed to embark on national newborn screening. When we say newborn screening, that means that in the first 2 weeks, at least the first 2 weeks of the life of a child, that baby must be screened. And then once that baby is screened and then we get to know that this baby has sickle cell disease, it will be quite easier to bring in interventions, and then that will also tend to improve the life of this child growing up. So for Ghana Health Service, we have done this training and then supported these selected facilities with free screening for children under 5. That is what we have done so far. And then again, we have also been able, with the support of CHI, to develop the National Sickle Cell Disease screening and case management. One other thing was that people were doing their own things their own way. So now we have a standardized way of managing the condition and even of screening for sickle cell disease. So gradually we are getting there. We will get there, in
Yeah.
fact. So these are some of the things the service is doing in the space of sickle cell disease.
Gradually, we are getting there, and of course, yes, we will get there. Doug, before we go, your final words. If you can give us your final words. Doug, are you there? Okay. Patient, you can give us your final
So
word.
I want to tell
Oh,
every
okay. Doug is here.
I want to Since I'm here now. Okay, so I want to tell everybody listening to us today or watching us today that please know your genotype and also encourage your family members to know their genotype. So that is the first step, because prevention is where the real gains are. And now for all caregivers, please make sure that you know the genotype of your children. As patient said, we are trying to enroll the universal newborn screening, but we haven't achieved that yet. So if you are here and you have a child, please take the child to the hospital to know the genotype of the child, because early diagnosis make a difference. And for us as a community, as a nation, let's be very supportive. Let's reduce stigma and let's support families who are having individuals living with a sickle cell disease. And behind the diagnosis, let's all know that behind the diagnosis is a real individual who also have dreams, aspirations, and with the right support and treatment, they're able to live a very fulfilling life. Thank you all for joining today's session.
Thank you so much. Bisa, you wanted to say something. I've sent you a request you can accept and join. Anti-patient, you can also give us your last words.
Yeah. So we have gone through some of the hurdles caregivers and then patients face with treatment. When someone is carrying the sickle cell disease, how some of them tend to frequently visit the hospital, not to watch the hospital, but because they have infections at one point, at a point in time. So when we compare genotype testing, no matter the amount or the cost we are paying for genotype testing, when we compare it to the cost of treatment, I think genotype testing is way more better, a good preventive measure that will help us just so we make right reproductive decisions, and then we don't even get to that stage of running through the hospital all the time. So I will encourage each and every one on to, if you don't know yet, get to know, especially before you marry or before you decide on giving birth. And again, for parents or caregivers who have children with the sickle cell disease, I think Doug has mentioned a few things that we are expecting them to do. One of the things are also to for them to attend routine checkups. So, depending on the clients, you will be given a schedule of hospital visits. We make sure that as caregivers, we make sure that we religiously attend, because any time they visit the facility, they have some lab investigations that they do, and then that will also inform their treatment options as well. It will help the healthcare professional as to what to take out and what to add to your treatment. And then to family members, community members, I think we need to all support them. We need to help reduce stigma by normalizing conversations around sickle cell disease. Of course, if someone doesn't know what it is, they won't be able to support them. If they don't tend to understand or appreciate what they go through, there's no way they can throw in their support. So, as healthcare workers, as family members, as co-workers, we can all help in screening campaigns, one, and then we can also help in raising awareness, so that when people get to know and understand the condition, they can really support people living with sickle cell disease. And also for patients with a sickle cell disease to know that there are other services beyond the medications and the other things, where they are so much stressed, they are supposed to see a professional for psychosocial support. And then other service care, healthcare worker services like the eye service, the mental unit. Whenever it is needful, you feel so stressed up, and then whichever services you need to talk to your healthcare provider, and then you'll be referred to the professionals there to receive the appropriate help. Yeah, so let's take the pain to know our genotype, at least because today is World Sickle Cell Day. Just give that to us as a gift to the sickle cell disease community, to know your genotype. Thank you.
Thank you so much. I have a question for you, patient. Somebody is asking your plan as a focal person for this disease. What's your plans for the nation? You want to know? I think she mentioned a few earlier, but you were not. I don't know. But Auntie patient, please, if you can repeat a little bit for us.
Yes, so we are doing healthcare worker capacity building across the country. We are also supporting facilities with test kits and then confirmatory tools so that it will help them to facilitate screening in their various facilities. Again, we are also liaising with sickle cell disease support groups. We have a few vibrant ones in the country. For example, the one in Ridge Hospital, they are very vibrant. So this year, we're able to collaborate with them within some few weeks with the NCD team and then the health promotion team. And then we're able to come up with a lot of materials. We have flyers flying today onwards. We have a couple of videos that will answer to all your questions. So we are on course to support and then help reduce the burden of sickle cell disease in the country.
Okay. All too soon, we are coming to the end of this program. If you just join us, this is the Ghana Health Service Good Life platform chat room. We do this every Friday evening, 7. Yeah, we come live exactly at 7, and we do this every Friday. So make it a point to join us every Friday, so that we have a fruitful discussion on. Normally, we post the topic that we'll be talking about on our page within the week. So, if you are not following us, kindly follow us so that you'll be informed about our next our next
Mr.
thing
Sakode.
that we will talk about. Yes. Um, somebody, Morano. Yeah, Morano. Okay, you can unmute and talk. Morano, you can unmute.
Oh, good evening, sir. How are you doing, sir? It's
I'm
been a long
doing
time.
well, Morano. How are you too?
Ah, oh, nice, nice. Glory to God. Glory be to God,
What do
Mr.
you
Sakode.
What do you have
Honestly, I
for us?
wanted to add something small before you close your
Okay,
this
okay.
wonderful program over here. I think anytime I talk, I will say one thing that since the nation is doing its possible best to make sure that health is key in its policy, let's take advantage of it. I'm saying this in relation to the national health insurance.
Yeah.
The scheme at the moment, or in a benefit package, covers or treats sickle cell disease. And I believe that if every Ghanaian is enrolled on the scheme, or make sure that his card is active or membership is active, I believe that he or she will not be deprived of this benefit. So in going forward, it is easy. If your card is not active or you are not on a scheme, you just dial the star 929 ash. You follow the prompt, you just register and you'll be on board. And I assure you that there are a lot of benefits. Let's take advantage of that. Thank you.
Mr. Morano, why you work at NHIS? you know?
I was going to ask, I'm happy you came around with this. I have a question for you too.
Yeah. Mr. Morano, please.
Mr. Sakode,
Yes.
this is Isaac, your
Oh.
gentleman, Isaac, from corporate from
Yeah,
health promotion division now at
I,
anytime. So I'm
I
surprised you
know.
don't recognize me.
I
We go
suspected
way
it.
back.
I suspected it, and it's good you raised it. So yes, I mean, let's all try. And if you're not on the NHIS scheme, let's try and be on it. It's very good. Back in the days when people were saying that it only takes of para and things, no, please, it's not para and things. It's very taking care of a lot of diseases, a lot of surgeries pregnant women when they go for antenatal and all that, and those consultations at the hospitals and all. Personally, I have benefited a lot. I'm sure some media mining can be great. Yes, but I mean, let's
Mr.
also
Mr.
try.
Sarkodie, apart from you benefiting, I know your wife has also benefited a lot.
Hey, Isaac,
Yeah.
Isaac. Overpass him, yo. Yes, of course.
Yeah, so Mr. Moderator.
Yes, yes, dog.
Yes, so this is patient.
Yes,
So
patient.
we all know hydroxyurea is on the NHIS, yes, but our problem is with the level of prescription. So for someone who is living with sickle cell disease and then the person is staying in the primary healthcare area, the person cannot access the hydroxyurea in that level. It can only be accessible in the secondary facility level. So the issue is about access. We know it is on. It means that if I am staying in an area that they don't have a regional hospital, I need to travel all the way to the nearest one. And I know a lot of people travel all a long way from even other regions to Accra Regional Greater Hospital, all because of access. So I don't know if that those policies could be reviewed. That is one of our biggest challenge.
Yeah.
Okay. Mr. Sarkodie, can I talk? Can
Yes.
I add something to?
Yes.
Okay. Okay. So, patience, right?
Yes.
Is it patient?
Yes.
Yes. Honestly, I think it's it's something that is affecting us as a Ghanaian in terms of the primary and the secondary and the tertiary hospitals, the way we do our payments. It is because of when they are being given credentialing, they come for assessment, and based on the assessment, it is upon that we determine if this facility is a primary or a secondary or a more higher level facility than the other. So it doesn't only the sickle cell treatment or service that the hospital renders. They consider a lot of factors. So I think in policy development with the Ministry of Health in going forward, they should maybe try and have these secondary hospitals in almost all the regions across the country, so that every region has that secondary hospital. Okay, so that no matter where you are in the country, we can at least credential a hospital that is capable. So even let's look apart away from only sickle cell diseases. Let's look at other diseases that this primary health hospital, if we have those kind of high level hospitals and they can render those services, NHI is always willing to provide that or that financial backing. The hospitals could also be built across the nation. I think that is one thing I can add up. Thank you.
Okay, thank you, Isaac.
Thank you.
Isaac, kindly share the NHIS code again, the short code that we can use to activate or register the NHIS. Kindly share it again with us. Isaac.
So you dial star 929. Hello.
Yes, we can hear you.
Yes. So star 929. Yes. So you dial star 929. Are you there? Please, can you hear me?
Yes, we can hear you. Please go ahead. Okay, so I think I heard star 929. Yes, that is the NHIS short code that you can use to activate either renew. I think you can use that to renew your NHIS or even register as a new client that you want to be on it. So just dial star 929 and you can be on. Okay, so all too soon, we've come to the end of the show, and thank you everyone for joining tonight. We are grateful. Francois, are you there? Francois, let me give you the opportunity to say something before we close. So, Francois, if you can accept and introduce yourself and add your voice to this. Before that, today we had after Francois is done, we had a very nice video. We premiered a video at the Sickle Cell conference today at the Town Palace, and I had the opportunity to get a video to share it with our viewers and listeners over here. So we will play the video once we are done for everybody to see. It's a very nice animated video and very educative too. Francois, can you hear me?
Hello, Issy baby.
Yes, my love.
Francois, can you hear me? Okay, it looks like Francois is not hearing me, but yes, before I sign off, we do this every Friday from 7 p.m. going. So next week, don't miss it. Come early and join us so that we can have a fruitful discussion. Let me see if I can project the video for us.
Hello, Issy baby.
Yes, my love.
Mafi wo, Are you alone?
Yes.
Ha! I am coming over.
Yay, my baby's in. Baby, what did you bring for me? This ice cream is so good.
Come over here. Hello, Izzy. I missed your call. All good? Izzy?
Kwame, I'm pregnant.
You are what?
Oh God, I beg. My baby. What's wrong with Mabuna? See how her hands and feet are swollen.
Issy, please let's go to my office. The test results are in. They confirm she has sickle cell disease.
What?
Izzy, you could have told me.
Told you what?
Your sickle cell status, of course.
Hey, look at you. At least I know my status is A something. You don't even know whether yours is Q, Z, or whatever.
Please calm down.
Don't tell me to calm down.
I know this is very difficult, but right now, your daughter needs you.
How sure are you that she's even mine? She's not mine.
Hey, Masa. Who is not your child? Ebufusem.
I understand your frustration, but sickle cell disease is always inherited from both parents. Usually, the parents are healthy, just like the both of you. So unless you get tested at a reliable laboratory, you will never know your sickle cell status. And that's why awareness is key.
Awareness of what?
Awareness of your sickle cell status and the available reproductive choices that can help you make an informed decision and even prevent sickle cell disease.
So you are saying we could have prevented all this if only we knew our sickle cell status and were offered genetic counseling?
Exactly my point.
Oh, doctor, thank you so much for your patience. You see, I am sorry. Mabna is my child.
But how can you say that to me? How?
Please.
Do you know how
I'm
painful
sorry.
that
I'm
is
sorry.
to you?
Know your sickle cell status before you become sexually active, because one decision today can shape the life of a child tomorrow. Point of care testing is simple and fast, with results often ready within minutes. In some cases, a confirmatory test such as the HPLC may be needed. Get tested today. Protect your future. Protect the next generation. For more information, call 0599 599 211 or visit www.iscc.international. This initiative is brought to you by the International Sickle Cell Center, another studio, Ministry of Health, Ghana Health Service, and partners.
So that was one of the videos. We have a lot of videos on our TikTok channel here. So you can just go on our profile and watch most of the videos that we've posted today. And we are still posting them. We will post a lot of videos and more educational videos. Just visit our pages, Good Life, Good Life Live It Well on all social media platforms, and you'll be able to get all these videos. So thank you so much, everyone, for joining us this evening. My name is Prince Owusubana Hinesakodia. We do this every Friday, like I said, and tonight we discuss. Tonight we've learned something very powerful, that is sickle cell diseases. If you missed it, don't worry. We'll be sharing a bit of it on our page. So if you're not following our page, kindly follow right now. And this week we will be sharing some of the a bits of it on our channel this week. So just follow our page, and you will get all this video. So before we close, you must not choose. You may not choose your genotype, but you can choose to know it. You may not choose every challenge in life, every challenge life brings to you, but you can choose knowledge, early screening, and support. Know your genotype, break the stigma, support those living with sickle cell diseases, because informed communities saves life, and every life matters. Follow us on all our social media channels, that is Ghana Health Service and Good Life social media platforms. So until next week, stay tuned. And also enjoy this music by Ghana Health Service. That's our World Cup song we composed to support the Black Stars. So enjoy it.
Service. We know they fall, we know they weak. World Cup dream, what we they see. We know they fall, we know they weak. World Cup dream, what we they see. Eat well, Ghana, what you go chop. Come to me, beans, me like we strong. Drink water, Ghana, stay alive. We they hydrate, we they survive. 2026 World Cup, we they go. We go play like who? We go shine like what? Golden light. Golden light. Healthy nation, strong foundation. Who build down? Good life, live it well.
Let's bring this trophy home.
20th World Cup, we remember the name. Good life, live with strong. Good life, live it well. Good life, live it well. Good life, live it well. Good life, live
Good life, live it well. It's an everyday thing.